Narayana Health City leads the way with robotic-assisted knee replacement with the world's smallest customized implant, Bangalore. 7th November 2024, Narayana Health City has successfully performed a revolutionary total knee replacement (TKR) on a patient with severe osteoarthritis and significant deformities. The complex procedure utilized state-of-the-art robotic-assisted technology combined with customizable implants, a cutting-edge approach that offers unparalleled precision and personalization. The patient, suffering from dwarfism, had previously undergone surgery to lengthen his thigh bone. However, his short stature posed complex surgical challenges, compounding the severity of the degeneration and deformities. Upon initial assessment, the patient exhibited limited knee function, persistent pain and atypical bone proportions that made standard knee implants unsuitable. Further thorough investigations, including X-rays, scanograms and a detailed CT scan, revealed disproportionate distal femur dimensions that were too small for conventional prosthetics, underscoring the need for a highly customized approach. Managing this case required more than a standard implant. We needed to precisely match the patient's unique bone structure, explained Dr. Prashanth B N, consultant Orthopedics Joint Replacement. Using CT imaging and 3D modeling, we designed patient-specific implants that accurately replicated the natural condylar proportions and ensured precise rotational alignment, which is essential for joint stability and function. This advanced approach not only restored function to the knee but minimized complications associated with the patient's complex anatomy. Professor Arun Ranganathan, Director HOD, Orthopedics, Spine Trauma, noted, "Our hospital is equipped to provide comprehensive orthopedic care with a dedicated team and advanced solutions for complex cases like this, ensuring the best possible outcomes." Narayana Health City can deliver such outcomes. Tim.
A few months back, we had a press meet saying that we had done more than 300 cases of robotic knee surgeries, and now again we are in the press to present one more thing. So this is slightly different from what we have done in the past. So this is very interesting case because the moment the patient came to the OPD, I was under shock seeing the patient. Where we asked the patient to sit, he is standing beside the chair of the chair height. So I slightly got confused what to do with him. So his initial complaints were knee pain, but the knee pain is going for many years. And the more interesting, so initially we thought he would settle down with simple pain medication. He's taking this medication for last 5-6 years, and he is doing all kind of physiotherapy, but his pain problem is not settling. So started investigating, we realized that it is not just his knee, it is his hip also facing a problem. His overall lower limb alignment is slightly bent inside, that is what we call varus. But this bend is compensatory to the problem what he has in the hip joint. So normally we have done plenty of surgeries like this with the deformity, we have corrected it. But in this patient, it is a compensatory deformity which is helping him to move on. So correcting this deformity completely will also give him problem. So then we tried our past experience, when the deformity is there, if you want to do knee replacement surgery, I think the robot comes into picture. So we have our robo, which is a completely automatic robo, which is a bird based technique, and we have well trained in it, and we had crossed many number of patients we have done with these surgeries. So we thought, yes, this can be an easy thing to go with the robo. So we tried to proceed with the robotic surgeries. So similar varus bent patient who had difficulty in walking, so they were comfortably corrected by our robotic surgeries. Okay, so we have plenty of examples like this, wherein this patient, what you're seeing, is having more than 20 degree of deformity with multiple loose bodies in the knee which were removed, and then he was comfortable walking. And there is one more patient, we have already talked about this guy. He had a femoral implant in his knee, and that was also corrected without taking out the implant. So these are the advantages that we are already experienced with. So that's why we thought we'll take this challenge. and we, in this robo, many of the time we plan the surgery, we exactly know where the implant sits and how it will be sitting inside the body. So when we try to plan, the same thing I had spoken in the my article on the paper. So similarly, a patient with severe varus deformity, when he is this varus deformity is comfortably corrected by our robotic surgeries. In patients with severe deformed knee also was comfortably corrected by the knee replacement surgery with the robotic help. My colleagues suggested that it should be a patient-specific implant, and then we inquired with few of the companies. They said this small size of design is not possible. Then luckily I got a person from Orthopedics who said that yes, we can do it provided you give us the idea, give us the details of the patient and give us the dimension what you want. So all these details need to be given, then we can plan and do the surgery. And then I thought yes, we will go with this. And when I came back from the conference, I spoke to our director, Dr. Dilip. So he was our financial manager. So he said that yes, this thing can be done. Somehow we will help it. Only thing is patient should be 100%. Then we realized that since the femur is deformed, there are other problems to it added to it. There were ligaments which are imbalanced. So we need to address these ligaments also, or you have to correct the rotation so that there is no stress on the ligament. So I spoke to one of my colleagues, Dr. Prashanth B N, who handles ligamentous injuries. Then he said at this age, correcting the ligaments is much more riskier. It is better to correct with the implant only. And then the deformity also, when we discussed with our deformity surgeon, Dr. Purushottam, so he was also of the opinion that it has to be accurately designed for this patient so that this implant will not trouble any of other his body parts. That even included his spine also. Patient has some problem in his spine, so that would also get affected his walking style or ligament stress changes. So when we discussed with our spine colleagues, they were of the opinion that we should go with the patient-specific implant. But with all this discussion, then finally we decided to go with the implant. So this was his view of his spinal problem. This is how we discussed with the patients. And we tried to get the other implant which is a smaller size. And in market, the smallest size available was more than 5 centimeter in dimension, but his femur was less than 4.5. So then we customized the implant, and this implant that you can see, this is the bone model.
ನಮ್ಮ ಹೆಸರು ರವೀಂದ್ರ, ಗುಲ್ಬರ್ಗದಿಂದ ಬೆಂಗಳೂರು ನಾರಾಯಣ ಹಾಸ್ಪಿಟಲ್ ಬಂದಿದ್ದೇನೆ. ನಾವು ಡೈಲಿ 6 ಗಂಟೆ ದೇವಸ್ಥಾನದಲ್ಲಿ ಪೂಜೆ ಹೋಗುತ್ತಿದ್ದೇವೆ. 5 ವರ್ಷದಿಂದ ನಮ್ಮ ಕಾಲು ಭಾಳ ಪೇನ್ ಆಗ್ತದೆ. 2 ತಿಂಗಳಲ್ಲಿ ಭಾಳ ಜಾಸ್ತಿ ಆಯಿತು. ನಮ್ಮ ರಿಲೇಷನಲ್ಲಿ ನಾರಾಯಣ ಹಾಸ್ಪಿಟಲ್ ಕರ್ಕೊಂಡು ಬಂದಿದ್ದಾರೆ. ಡಾಕ್ಟರ್ ಪ್ರಶಾಂತ್ ಬಿ ಎನ್ ಮೊಳಕಾಲು ಆಪರೇಷನ್ ಮಾಡಕ್ಕೆ ಹೇಳಿದ್ದಾರೆ. ಈ ಸಂದರ್ಭ ಅಂದರೆ ನನ್ನ ನೋವು ಕಡಿಮೆ ಆಗುತ್ತದೆ ಎಂದು ನಾನು ಭಾವಿಸುತ್ತಿದ್ದೇನೆ. ಆಪರೇಷನ್ ಸರಿಯಾಗಿ ಮಾಡಿದ್ದಾರೆ. ನಾನೀಗ 10 ದಿವಸ ಆಯಿತು ಪಾತ್ರ ಹಿಡಿದು ನಡೀತಿದ್ದೇನೆ. ನಾಳೆ ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡ್ತಿದ್ದಾರೆ.
ಊರಿಗೆ ಬಂದಮೇಲೆ ಸ್ಟ್ಯಾಂಡ್ ಹಿಡ್ಕೊಂಡು ನಡೆಯೋದ್ರಿಂದ ಅವರು ಒಬ್ಬರೇ ನಡೆಯೋಕೆ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರು. ಇವಾಗಂತೂ ಏನೂ ಏನಿಲ್ಲ. ಅವರ ಕೆಲಸ ಆಯಿತು, ಅವರದ್ದು ಸರಿಯಾಗಿ ಮಾಡ್ತಿದ್ದಾರೆ. ನಮ್ಮದು ದೇವಸ್ಥಾನ ಇದೆ ಅಮ್ಮಭವನಿದು, ಅಲ್ಲಿ ಪೂಜೆನೂ ಅವರೇ ಮಾಡ್ತಾರೆ. ಅವಾಗ ಸ್ವಲ್ಪ ನಿಲ್ಲೋದಕ್ಕೂ ಆಗ್ತಿರ್ಲಿಲ್ಲ. ಇವಾಗ ದಸರೆಗೆ ಮೊನ್ನೆನೇ ಜಾತ್ರೆ ಆಯಿತು ನಮ್ಮ ಊರಲ್ಲಿ. 8ರಿಂದ 10 ಗಂಟೆ ಮೆರವಣಿಗೆ ಇರುತ್ತೆ ಪಲ್ಲಕ್ಕಿ ಊರಲ್ಲಿ. ಆರಾಮಾಗಿ ನಡ್ಕೊಂಡು ಹೋಗಿ ತಾಯಿ ಜಾತ್ರೆಯನ್ನು ಮುಗಿಸಿದ್ದಾರೆ.
ದಿನಾಲು ತಿರುಗಾಡ್ತೇವೆ. ಕಾಲು ಏನು ತ್ರಾಸು ಇಲ್ಲ, ಏನು ತೊಂದರೆ ಇಲ್ಲ ನಮ್ಗೆ. ಸುತ್ತ ಹಳ್ಳಿ ಎಲ್ಲ ಭಕ್ತರು ಕರೀತಾರೆ, ಹೋಗಿ ಎಲ್ಲ ಪೂಜಾ ಪಾಠ ಎಲ್ಲ ಮಾಡಿ ಬರ್ತೀವಿ. ಏನು ಕಾಲು ತೊಂದರೆ ಇಲ್ಲ ನಮ್ಗೆ.
Hi, I am Dr. Prashanth B N, orthoplasty and robotic surgeon at Narayana Health, Bomsandra. So today we'll be discussing about an interesting patient by name Ravindra. He came with a pain in his left knee. So when I went through his details, I investigated him to know the problem. his X-ray shows that he has osteoarthritis of the knee. The next important thing which again surprised me is he has already understood the need for a patient-specific knee. So I have to go to a patient-specific implant. So in this we get a CT scan and we get a bone model out of it. So that bone model roughly replicates the bone of the patient. So with that bone model, we design the implant that is of the dimension which matches the native bone, and this implant requires specific instrumentation to place it. That was also created, and with this we did a surgery for him where his femur we did a bone cut, and then the implant was placed in the same way. The bone cuts were made in the tibia and the implants were placed. Since these were patient-specific implants, even though there was a bend and a deformity in this femur and tibia, we could conveniently get away with this surgery, and the patient is benefited by this surgery with good results.